To all who are watching, I'll be representing Figure 13 talking about case 5, which is a 10-year-old boy who was brought in by his mother for a weight problem. He was delivered by cesarean for macrosomia and he had normal developmental progress thereafter. However, during his examination, his weight was 60 kg and his height was 1.35 meters. His fasting blood sugar was 8.5 and his random blood sugar was 12.1. So the first question is, what are the clinical and lab features that suggest that this child might have a type 2 rather than type 1 diabetes? So the differentiating factor we believe would be our patient's clinical features of being obese with a BMI of 32.9, as well as his asymptomatic insidious onset, as well as being born with fetal macrosomia, which increases his risk of developing type 2. Hence, this further affirms the direction in type 2 rather than a type 1 diabetes. So additionally, other factors that could be present would be a history of type 2 running in the family. We will also check for presence of complications such as retinopathy, neuropathy, and nephropathy. Other than that, acanthosis nigricans as well as hyperosmolar hyperglycemic syndrome could be presented, and that should not be missed. Other supporting factors of type 2 diabetes would be a background ethnicity as listed below, as well as poor socioeconomic factors. So the lab features of 8.5 fasting and 12.1 random blood sugar are both high respectively. We will also look for C-peptide and insulin levels that may be normal or elevated. Additionally, we will also screen for ketone bodies as well as any signs of metabolic acidosis. So the second and third questions would be, what are the choices of antidiabetics we would suggest for him, as well as our justifications. So we'll be looking at metformin, which is a cheap and safe, and it doesn't risk hypoglycemia occurring. So the side effects such as nausea, anorexia, and diarrhea can be minimized when metformin is taken with or after meals. Metformin is also weight neutral, and this is important as our patient is currently obese. According to the CPG, metformin may also result in a weight loss of up to 1.1 kilograms, which is beneficial to our patient. Insulin, however, would be needed for initial metabolic control and can be switched to metformin when control is achieved. Next, we'll be looking at liraglutide, which is a glucose-like peptide 1 analog, and this promotes weight loss. According to the CBG as well, it can be considered in adolescents in type 2 if the glycemic targets are not achieved with metformin. Liraglutide is also taken orally, and this is preferable over weekly injections because it would be invasive for him to receive injections weekly, and that would also probably decrease compliance. So moving on, drugs that we do not suggest would be DPP-4 and SGLT inhibitors because their efficacy in the pediatric population is not well proven. Last but not least, the other issues that we would like to address in our patient would be his obesity, his weight. We would advise on a diet regime to cut down on empty calories with high GI and suggest taking food high in dietary fiber to reduce gastric emptying. We will also advise on an exercise regime for our patient. Next, regarding compliance, we would ensure that our patient takes drugs at his stipulated time, so we would like to monitor his compliance because if he skips medication, that would lead to unwanted complications that we would like to avoid. So apart from compliance monitoring, we also monitor for acute and chronic potential complications such as the hyperglycemic hyperosmolar syndrome, the ischemic heart disease, retinopathy, nephropathy, and so on. So with our child being a patient, he might require psychosocial support to avoid developing depression because people with type 2 diabetes are predisposed to depression, and that will lead to a poor prognosis. Our patient will also benefit from psychosocial support because he is a child, and that would having diabetes would be a barrier to his development and social interaction. So we believe that it would help him to cope. So I believe that will be all for our group. Thank you for listening.